split tube is an overtube with a longitudinal split. This device can be assembled over endoscope and colonoscope and inserted into gastrointestinal tract. Without any further ado, we're going to proceed with the experiment. The first step is insertion of the colonoscope. Here, I advance the colonoscope almost into the transverse colon. After reaching to the desired place in the gastrointestinal tract, we will assemble the overtube over the colonoscope. We are starting with the distal part of the overtube, and colonoscope is placed within the overtube, not all the way, but in part. The seam is closed using self-fusing silicone magic tape. This tape has special properties that only stick to silicone. This tape does not stick to glove or colonoscope or gauze, and only adheres to the other side of the overtube. As you see, the tape is made in segments, so we can close one segment at a time. The tape has a release sheet that needs to be removed before being applied to the other side. When we secure some part of the overtube over the colonoscope, we can lubricate the overtube and insert the closed part into the colon. This allows us to just use a small portion of the colonoscope for assembly of the overtube. We don't have to assemble the overtube all at once. This is the last part of the seam at the level of handle that now is completely closed. Now we can insert the overtube all the way till we see the tip of the overtube with endoscope. That means the overtube passed the tip, and we can pull it back, and at that level we're going to inflate the positioning balloon to secure the position of the overtube within the colon. At the next step, we're going to pass the occlusion balloon catheter through the port in the overtube. You will see that the catheter is going beyond the tip of the colonoscope, and when we reach to desired location, we can inflate the occlusion balloon. Now we are having positioning balloon in place, we are having occlusion balloon in place, and the next step is to seal the colonoscope within the tube using a balloon cuff. After inflating that balloon cuff, our compartment is formed. We can insufflate the compartment, in this case with CO2. Now, inside the compartment, the scope can independently move within the compartment. In addition, the occlusion balloon can be moved independent of the colonoscope or overtube, so change the size of compartment, and also we can move the whole compartment with endoscope within the gastrointestinal tract. So we can move the compartment to the different part of the gastrointestinal tract altogether. After that, we can remove our endoscope or colonoscope from the compartment after deflating the sealing cuff. We can insert now echo endoscope or EUS device through the overtube into the compartment. Now we will reinflate the cuff, and we can fill the compartment this time with water. After that, we will start seeing endosonographic images of the colon. First, we are seeing the lumen of the colon, the layers of the wall of the colon, and now we are seeing structures beyond the wall of the colon. This is an uncharted territory, so I'm not 100% sure what structure I'm looking at. After the procedure, we can start deflating all the balloons, and we can easily remove the overtube from the colon with or independent of the scope.